see how that goes. So I, like many of you, have spent a considerable amount of time over the last 2 years mourning the imminent end of this illustrious program that brings us together year after year to share and to suggest and to learn together how we might improve health and healthcare in the United States. I will miss these meetings. I will miss the conversations that I have regularly with the scholars, with the faculty, with the site directors, with the NAC directors, with the members of the NAC, and also with the National Program Office, and I will really miss Singerman's. But I will not miss the excitement that I receive every time I receive a notification that one of our scholars has published a paper or a book, producing insights that can influence policy and show us new ways to build a culture of health. Scholars in health policy research are prolific and resourceful and will continue to produce and to mentor others who produce these insights for years to come. They will continue to attain local, state, and national health leadership positions, and they will also, as I told you last night, continue to receive funding from the Robert Wood Johnson Foundation. So I became this program's program officer at the same stage that most scholars enter the program, and a good deal of what I have learned that has helped me in my career I have learned from this program. I learned health policy. I learned about political science and more about sociology. I learned about bureaucracy, mostly from Berkeley, but some from RWJF. I learned negotiation skills, and I gained experience with creative problem solving. I learned how philanthropy worked, or I guess how our philanthropy works, from David Colby on our 4-hour drives from Denver to Aspen. David Colby, for those of you who don't know, is the reason that I have a job at RWJF. The story is that they were nervous to hire an economist because they thought it was unlikely that I would fit in with the foundation culture. And David convinced them that I could handle it, or I guess maybe that they could handle me. I learned to balance motherhood and a career with the help of my mother, who traveled with me on site visits and to the annual meetings for 5 years. And though I learned so much from every break time conversation I had with NAC faculty, site directors, and scholars, I feel the need to call out in particular the gratitude I hold for Eileen, for Kathy, for Catherine, for Karen, for Kosely, and for Bobby, who offered important touch points to me over the last 12 years, some of which were harder than others. The foundation has been funding the Scholars in Health Policy Research Program for 25 years. It's on the very, very short list of the longest running programs at the foundation. And it's been funded year after year because of its signature status and because of its value to the foundation. Now, it would be a lie to say that it was easy to continue to secure the $86 million that it has cost to run this program. But it's not because, as David Colby likes to joke, we had to convince our board of directors that researchers are people too, or because our colleagues didn't understand that long-term commitment has long-term payoffs. It's because, as John said last night, $450 million a year is just a drop in the bucket if you're trying to build a culture of health. In fact, many of the programs that competed for funding with this program are the very programs that this program suggested that were crucial to our efforts to combat obesity, reduce disparities, and increase insurance coverage for our nation's poorest people. And I consider that a real win for this program and also for the Robert Wood Johnson Foundation. As we reach the end of an era, we celebrate the insights of the scholars who came through this program, We celebrate that the insights that scholars who came through this program provided guided the efforts of the Robert Wood Johnson Foundation and other funders working to improve health. We celebrate the health policies, and that's little p and big P, the research of the health policy scholars have guided. We celebrate the health behaviors of individuals the findings of health policy scholars have improved by producing new insights about how to influence behavior. We celebrate the past, and we look forward to the future. I want to echo the many kind words that were shared about Melissa, Jed, Eileen, Tracy, Nora, Christine, Katie, and of course, Alan. And to conclude, I would like to invite all three of you back to the stage, David and Mark and Alan, as we present one more gift to Alan. we're presenting a picture that we will have framed for you to put in your office. It says, "Thank you, Alan, for over 25 years of creative, careful, tireless work to foster the development of scholars, mentors, and leaders in health policy research. Your work will continue to improve health and healthcare for generations to come from the Robert Wood Johnson Foundation." And you will never have to read the many names who are on this because you have them all in your memory.
You missed one.
You know, I probably did. I probably did. There's a list, all of the scholars and also every member of the advisory committee, and hopefully some of you can see there's the RWJF logo that's in there as well. So thank you so much from all of us.
Thank you.
Yes.
Thank you.